Hello, my name is Sharon. I would like to respectfully acknowledge the Turrbal traditional owners of the land on which I stand and elders both past and present. For my presentation, I've chosen medicinal foods of the San people of Africa. The San tribe were formerly known as the Kalahari Bushmen and is sometimes referred to as the Basawa. The San tribes live throughout Botswana and are considered to be the original indigenous people. They also inhabit Namibia to the left of Botswana and parts of South Africa, as the Kalahari Desert spans these three countries. A main community of the San is the Kong people, whom have a rich knowledge of edible and medicinal tubers and roots. The Khoi of the Cape area referred to the San or San Qua as people Kwa, who anointed themselves with bushes San, due to their habit of massaging ointments made of aromatic leaf powders called buku mixed with fat in their healing. Edible plants are harvested from the wild and used medicinally as food and herbal teas. Some interesting examples are camel thorn, fresh roots are chewed for strong pain of the chest, stomach or head. Worm bark, the inhaled smoke from burning roots stops nosebleeds. Zebra aloe, they used aloe much as we do for burns and skin ailments. And the sour plum, an ointment could be made from the kernels for wound healing and a root decoction for the chest. Hoodia goldoni is a leafless succulent cactus-like plant with spines. It is related to many fleshy succulents used for food in South Africa, yet it was only eaten in the Kalahari, where its juicy young shoots were peeled and eaten raw or cooked. Hoodia pilifera is the more commonly edible succulent known as guap, and a liquid with a licorice flavour. The spines of Hoodia species are removed and the long body is crushed and dried in the sun before being pulverised into powder. Traditionally, it is used for its appetite suppressant effect. Clinical trials of the crude extract in rats showed efficacy by reduced dietary intake and reduced weight loss over specific time frames. Yet clinical trials using extracted constituents in humans showed no efficacy for diet suppression and minor adverse effects such as nausea, emesis, and significant changes in vital signs such as blood pressure, pulse, heart rate, and bilirubin levels. Devil's claw, Gophytum procumbens. It is a creeper that radiates from a central underground tuber. It is named for the fruits which form sharp hooks and thorns. Image 4 shows the thorny flower, the plant in flower, the distribution of its habitat, and a San woman demonstrating its use. The secondary tubers are gathered and sliced and dried in the sun before being pulverised, or traditionally the roots are chewed or boiled and later the liquid substance is drunk. As a tea to treat intestinal disorders, gallbladder disease and gallstones, kidney conditions, diabetes and atherosclerosis, blood diseases, fever, dyspepsia, UTIs, general body aches, especially the muscle and joint aches of the elderly, during childbirth, internally and topically on the abdomen, for postpartum pain, expelling the placenta, menstrual cramps, and to cure high blood pressure. It was also applied topically as powder with animal fat to treat arthritis, pains, sores, ulcers, boils, wounds, burns, and cancerous growths. Clinical studies prove efficacy as an analgesic and anti-inflammatory via inhibition of the COX-2, TNF-alpha and NF-kappa-B inflammatory pathways. Devil's claw exerts a clinically significant antioxidant effect in rats, which may be responsible in part for its anti-inflammatory action. Anti-diabetic efficacy was seen in clinical studies of rats who showed reduced blood glucose levels after administration with an aqueous extract. No efficacy for microbial activity was seen, although chemoprotective effects and cardiovascular effects, including hypertensive, reduced arterial blood pressure and heart rate, are clinically significant. Contractile effects on isolated animal intestinal tract and esophagus pieces were seen and defined as anticholinesterase activity. Uterotonic activity was confirmed, and initiation of strong uterine contractions in tested rats confirms traditional use of this herb. A Cochrane review determined H. procumbens to be an efficacious pain relief for back pain. In vivo testing shows definite anti-inflammatory and analgesic activity via perturbance of the arachidonic pathway. It was reported, interestingly, by von Koenen in 1996, an indigenous South African, that Africans regard the European intensive use of this plant as damaging to health. Griffon disticha is one of many plants of the family Amaryllidaceae, and its common names include century plant, poison bulb, and sore eye flower, as eye irritation occurs if in a confined space with the flower. The San people used it to poison their arrows and darts, and it is depicted in their rock art. It's a hallucinogenic, symbol of eternal life, and is used in trance dance healing rituals. It is a deciduous large bulb with scales where former leaves have grown and hardened. The bulb is most often used, although leaves, flowers, and roots are also used. The bulb is uprooted during harvesting for use as a medicine, with those that grew in the shade gathered in preference to the sunny positioned ones due to increased poison effectiveness for hunting. Infusions of the bulb were used as a tonic and to treat epilepsy, stress-related ailments, anxiety, depression, psychosis, insomnia, and age-related dementia. The scales were used to treat asthma, and it was used topically for wounds, bruises, rashes, boils, swelling, cuts, to relieve pain, draw out pus for muscle pain and stiffness. Gastrointestinal uses include enemas, fresh bulb decoction for constipation, and as an emetic and purgative. It was used as internal purification of blood, bladder, uterus, the digestive system, and to treat cancer. The leaves were used to stop bleeding. Bufone disticha contains alkaloid constituents that demonstrate serotonin activity in humans. And I have to say, it makes me happy just to look at this amazing flowering bulb. Mice treated with bufone exhibited less cardiovascular signs related to anxiety states compared to control or diazepam-treated mice. Binding to enzymes involved in reuptake of serotonin, noradrenaline, and dopamine has been shown clinically and supports efficacy as an antidepressant. Psychoactive properties include sedation, analgesia, hallucinations, and coma. Cognition-enhancing properties are known to be due to the alkaloid constituents galantamine and sanguinine, which act as anticholinergics and can treat age-related dementia and memory loss. Ethanolic extracts of bufone bulb have shown clinically significant activity against Staphylococcus, E. coli, K. pneumoniae, Candida albicans, poliovirus, herpes simplex virus, and malarial parasite via liacrine and COX-1 selective inhibition, thus proving efficacy as a topical antimicrobial and anti-inflammatory agent. 60% of anti-cancer agents used clinically are derived from nature. Quinine and lycorine are potently cytotoxic to immune cells and cancer cells via apoptotic and anti-proliferation mechanisms, and therefore this plant has good pharmacological evidence for use in cancer, yet more clinical research is necessary. No evidence for efficacy in treatment of epilepsy, asthma, or gastrointestinal function is found. As an oral and holistic, locally bound culture and context-specific tradition related to survival and subsistence, any rapid change, including the adoption of different values and lifestyles from those of their ancestors, challenges the San people's maintenance of their traditional knowledge and use of medicinal foods. Discontinuity as younger generations lose interest, with fewer trainees entering the profession, and with loss of use, the medicinal plants lose value and at risk of extinction. Overexploitation to fulfill industrial demands and as an income for poverty-stricken individuals further exacerbates this. external implementation of conservation strategies, including modern tissue propagation and industrial or commercial use, can impact on traditional access and use of medicinal plants and erode the traditional knowledge. Decline in credibility in traditional healers, and lack of and acceptance of indigenous medicine are important, and not only by local people but also and possibly more profoundly by policymakers and practitioners of biomedicine. Bioprospecting, the search for medicinal plants and active ingredients, and even biopiracy, exploitation and appropriation by unauthorised parties under Western intellectual property law of biological resources and or associated traditional knowledge without the holder of the TK's approval, consent or adequate compensation particularly occurs in developing countries such as Botswana. Botswana has signed on to the Convention on Biological Diversity and also has in place the Industrial Property Act to legislate the production of TKs on a national level.